I'm Dr. Ryan Stanton, and the doc is in. When we do these segments regarding the COVID-19 virus, or the coronavirus, out of Wuhan, China, we're very limited in terms of the times that we can use when it comes to TV broadcasts. What we wanted to do, though, is bring you the rest of these quotes and experiences that we're seeing from Americans that have been in China. We talked with Butch Tanner and Kara Arvin about their experiences living in China when this outbreak took place.
One thing I know on the coronavirus that we watch is that the reactions of the people are very fearful. People are afraid of how it's transmitted, how it's going to be affecting them personally. They don't want their family members involved with other people. They don't want their helpers going and being a part of anything outside of the work of the flat there. There's just this constant fear that has gripped people because of the coronavirus.
It was quite eerie. There was not a lot of people around. Most of the stores were shut down, or the grocery stores were open for just a few hours every day, and then most people were covered up with masks.
A common theme that we've seen throughout these discussions has been the challenges in communication and the messaging from the Chinese government.
It was not very clear, and I don't know if that was deliberate or not. It seemed like they only gave you partial information, and then most of it was just positive, such as the virus was going to be gone in a few weeks, whereas you get other information from America or Europe that it was going to take until like April or May.
Unfortunately, most people see the government's response as being very slow. They were slow to close the border, slow to set up quarantine, slow to react in some of the things. So that's created a lot of frustration and anger among some of the people. But they've also gotten mixed messages from the government, whereas there's this statement one day, and then the next day that statement is retracted. And so people don't know exactly what the valid source of news would be.
Another big theme has been a very compact and populated country that is now, in essence, living as ghost towns.
The number of people traveling throughout our area has dramatically increased. Now, when you think about it, our area is so densely populated, 57,000 people per square kilometer. It's hard to think about most of those people deciding not to go to work, deciding not to go out. The government has stopped civil servants from working. Mail delivery, those types of things have been interrupted. Government resources have been cut dramatically. People have been put on leave at work. So there's a lot of different things that have happened in order to be able to make it where people don't have to come and be a part of the normal events at work and everything else there.
They actually wouldn't let us leave our apartments without having a permit every other day. So that was kind of scary, being a foreigner and not being able to read Chinese or, talk to someone about it. You're kind of very isolated.
The combination of fear and restriction of the services in China have built some concern within the citizens, and also concerns for other things that may be complicated because of the coronavirus.
I wasn't scared of getting the virus. I was more scared of getting something else, like my appendix bursting or something, and I wouldn't be able to get necessary help because I didn't have any friends that were still in the country, and you weren't allowed to leave your apartment very often, and then the hospitals were all filled with possible cases, so it's kind of scary dealing with that. And then they were very positive in their media. Like, for instance, the city every day would play this like chant throughout the city. It was very scary because no one would be outside, but you just hear it of love will win, we can do this together, stay positive. So it was just strange, it was different.
Some of the doctors in our area are saying that the cases are significantly underreported, that there could be thousands and thousands of more people that are infected and carrying the virus than are currently aware of. So that heightens the fear level, that heightens the problems that are going on and makes people want to have less involvement with others.
The message that comes from all of this is that you need to make sure that you're doing the basic things to prevent infection between you and your family. Hand washing, vaccinations, covering your face and mouth if you happen to cough, being aware of where you're traveling, and keeping up to date with the information from the CDC and the World Health Organization. You can join the conversation on the Doc is In Facebook page and at EverydayMed on Twitter. I'm Dr. Ryan Stanton, and the Doc is out.